What if my client has already had a prior negative head CT or brain MRI?
Excellent question, and this is one we hear a lot, and there's some confusion around it, so I appreciate being able to address it. CT scanning of the brain, non-contrast CT scanning of the brain, is the first imaging study that most trauma victims get after they're rushed to the ER. I'm a radiologist. I've viewed thousands and thousands of CT scans right after the patient was brought to the ER after an accident. And it's excellent to see large gross injuries: epidural hematoma, subdural hematoma, subarachnoid hemorrhage, intraventricular hemorrhage, diffuse axonal injury, increased intracranial pressure, pneumocephalus, brain herniation. Excellent. You can see all those things that are, and most of those are surgical emergencies, so that have to go to the neurosurgeon as soon as possible. So CT scan, totally different from DTI, totally different from MRI. The most common study done when an accident victim first goes to the ER. The next type of imaging study done for the brain is a brain MRI. And I mean a plain vanilla brain MRI. I refer to as that because DTI, which is down here, which I'll talk about shortly, which is what we specialize in, is a specialized form of MRI, but nobody refers to these two synonymously. Nobody calls a DTI scan MRI. It is a specialized form, but it's referred to as DTI. When people refer to MRI of the brain, they refer to this, what I'm calling plain vanilla MRI of the brain. That's not done right after trauma, but sometimes in a few days, if symptoms are still there, you want to get a little better look, the physicians, they'll order a plain vanilla MRI. Both CT and MRI give a good look at gross anatomical structures and gross injuries, big ones. DTI is different. What DTI specializes is the indirect visualization of microscopic white matter tracts. White matter tracts in the brain are connections. There's trillions of them. And these connections make up who we are. Personality, mood, sleep, ability to think, ability to communicate, mood, anxiety, depression, bursts of anger, all of these things are governed by these connections. And when you have traumatic brain injury at the microscopic level, these are torn. These connections are torn. So the symptoms you see, same ones I alluded to earlier, are manifestations of these microscopic connections in the white matter being severed. Neither CT scan or brain MRI can see this. Only DTI, through some advanced indirect methods, can make assessments about the status of those white matter tracts and whether they're patent or they're disrupted. So if you had a client, had a history of trauma, real history, has real symptoms, you think something's not right, I think there's traumatic brain injury. But they've had a negative head CT, or normal or unremarkable, these are all synonymous, or an MRI of the brain, normal, negative, unremarkable. Does that mean they don't have traumatic brain injury? Not necessarily. They still could. That's where DTI comes in. That's what we specialize in. So if you have a client, patient client who has any of those symptoms, regardless of other imaging, give us a call. We'll talk to you. We'll talk to your patient client. And if we think it's appropriate, we'll do a DTI scan. And that DTI scan will, with a very high degree of confidence, tell us if there is microscopic traumatic brain injury or if there's not.